So the project that we conducted pertains to characterizing the types of materials emitted from cured-in-place pipe repair sites. Several of the presenters, several of the individuals that were co-investigators with this project are sitting with right now in this room, and we can answer questions later on about this project and other issues. The study can be downloaded online. It's freely available. It was published by Environmental Science and Technology Letters, a peer-reviewed journal that the American Chemical Society manages. You can also get more information from a website that we set up here at Purdue University pertaining to CIPP safety, as well as frequently asked questions that health professionals may have, that hazmat units may have, that CIPP workers or engineering consultants and municipalities may have about the technology. There's also some information published there for the general public. Well, today, cured-in-place pipe technology is used to repair about 50% of all water pipes in the United States. It involves the use of a resin-impregnated tube that is installed or inserted into an existing damaged pipe. That tube is then hardened in place by a process called curing, where steam, hot water, or UV light are used to harden that uncured resin tube into a hardened pipe. You basically create a new plastic pipe inside an existing damaged pipe. In the lower left-hand side of this slide here, what you see is a truck where a blue uncured resin tube is coming out. That truck is refrigerated to keep the raw chemicals in the uncured resin tube from not hardening during transport. They insert that tube into a manhole. They pull it through the buried pipe, and then at that point, they start curing it with either hot water, steam, or UV light. On the right-hand side, you can see a plastic pipe that has been installed inside a concrete pipe. And this process literally chemically manufactures a new plastic pipe inside an existing damaged pipe. This slide is meant to kind of give you an idea about the different complexities and variations associated with the design of these new plastic pipes. You can use different initial chemicals, you can use different resins, you can use resins with styrene in them, you can use resins without styrene in them. These resins contain fillers, catalysts, initiators that are added to create the uncured resin tube. You can insert the tubes different ways. You can pull them in place, or you can air invert or water invert them in. You can also polymerize the resin differently. You can use, as I mentioned before, thermal methods and UV methods. And you can also apply different cool-down methods. So after the pipe has undergone its curing process, different contractors use different methods to cool down that pipe to a temperature at which they feel comfortable in opening both ends of the pipe up and putting it into service. This slide here is only showing a quarter of what we meant to show, but basically in the upper left-hand corner, what you see is the uncured resin tube pushed into a sewer pipe, sanitary sewer pipe, and steam is being injected on the left-hand side, and that steam travels through the uncured resin tube. It keeps it against the wall. This is a pressurized application. And materials are then emitted out the downstream manhole, and sometimes through an exhaust pipe contractors set up on site, and those emissions are then projected into the air. On the right-hand side of this slide here, you don't see is the actual emissions from a CIPP steam church site from a manhole is in a residential area. And also, one of the possible challenges with this technology is that because you're using pressurized steam, sometimes pressurized hot water, and even forced air, you can push the emissions into sewer laterals, and then these can go into buildings and cause people to respond. And so one of the main questions about our study was to try to understand, are chemical emissions from this technology a potential problem? And in our research, we found about 59 incidents that indicated that chemicals were emitted into the air from cured-in-place pipe activities, whether that be contractors setting up their activities or whether they're installing pipe in sanitary sewer or storm sewer applications. These sometimes prompted the evacuation of daycare centers, elementary schools, middle schools, high schools, offices, and homes. Sometimes entire neighborhoods of homes, and sometimes those individuals had to go to the hospital to be checked out. There have been some incidents of contamination or chemical emissions due to storm sewer applications, and this is where cured-in-place pipes have been installed for stormwater pipes. And there have been issues associated with those, primarily due to the discharge of uncured resin and waste not properly contained, not necessarily during the installation process. Since July 2017, since our study was published, there have been 4 new incidents that we know about. And the last one that we know about occurred in San Diego, California, a few weeks ago, where 36 children seem to have been sickened by exposures to vapors due to a cured-in-place pipe process activity. When we looked at the literature to find out what exactly people were saying about chemical emissions to kind of see if there were a problem, we found a lot of statements and information that was being issued to the public by municipalities, by contractors, by engineering firms. And this kind of gives you an idea about some of the most common statements we found in our review of documents. On the right-hand side is a municipal worker who is inspecting a downstream sewer manhole that is near a steam cured-in-place pipe site. So the next aspect of what we did was we looked at air monitoring studies. What type of scientific information is out there that describes what types of materials are emitted into the air by these processes? And unfortunately, we only were able to find 4 studies available. There was one conducted in 2001 that is available online. 3.2 ppm is the only highest level of styrene that they reported detecting. They used charcoal sorbent tubes. They looked in different homes, and they looked at the work site as well. They did not monitor the emissions coming directly out of the pipe, but they did it near the pipe. In that study, they only found styrene, and so one of their conclusions was that
they're working on it.
Something to the ream of that the emissions overall.
How long have I been watching it?
Styrene.
I think it's an hour. Do you need something?
If there was another study conducted in 2004 by Bauer.
You know what? They'll probably send me, though.
Please go on mute. Please, guys, mute yourself.
If everyone could please put yourselves on mute and Dr. Walton.
Welcome, and thank you for joining us for today's session. My name is Sarah McManus, and I'm a critical care nurse and a Toxic Alliance Advisory Board member managing a continuum of care.
So what I will do is I will ask that everybody please put their devices and phones on mute so that we don't have different people calling in asking other people to put their devices and phones on mute. Please do that, and I will stop next time I hear something and remind everybody to do that. So of the 4 studies that were being conducted, we found there was another study conducted in 2004. This one indicated that styrene seemed to be present and emitted from a manhole at about 110 ppm. However, the study used a photoionization detector, which is a non-specific detector that may have been calibrated for styrene, but it doesn't necessarily mean that styrene was present. In 2005, ACSCR conducted a study where they investigated a building contamination incident, and they found that styrene was emitted from a sanitary sewer CIPP installation site into a building, and the contamination remained for 3 months. The building was evacuated twice. And then in 2015, there was a study conducted by a University of New Orleans student in Los Angeles, and she indicated that for 3 CIPP sanitary sewer sites that she monitored, over 1,000 ppm of styrene was detected at one of these sites. And she applied Tedlar bag sampling, and then she took that Tedlar bag and handed it off to a commercial laboratory that did all the analytical work. So that is a totality of evidence that we found in the literature associated with cured-in-place pipe sites. So the next aspect, what we did was we conducted a rapid response study funded by the National Science Foundation to better understand the materials emitted from CIPP, sanitary sewer, and stormwater pipe repair. You can see the different objectives of that study here. This study focused on steam-cured CIPP installations, primarily because those were the most popular and the easiest for us to find. Here's 2 videos that you can go online and look at. These videos show the installation of the uncured resin tube at one of our sites, and also the force and the magnitude of the emissions from an exhaust pipe that we visited. For field and laboratory analysis work, you can find a very detailed description of this in the published paper. I put these sampling and monitoring and equipment information up here for those of you that are interested in understanding the depth and breadth of scientific effort that we put forward in this study. The results of our study indicated that chemicals were emitted from the uncured resin tube before installation, and once the steam was injected into the uncured resin tube, once it was installed or placed in the sewer pipe, we had a very, very high PID response. And we reported as PID response because we cannot confirm if this is 1 chemical or 10 chemicals causing the PID response. So we think this is the most appropriate way to report this information. We did, however, take a Tedlar bag sample at about 50 minutes, and what we found is that there was styrene, which was part of the resin system used in this installation, but there are also other chemicals that were present as well. And so this gave us an idea that also with time you see a reduction in the PID response as the curing process continues. Something very important to our study, one of the most important findings, is that the white material that was emitted from one of the sites that we went to was not steam, but was a multi-phase chemical mixture. So this included solids, liquids, and gases. And historically, it's been referred to as steam, and the evidence that we collected did not indicate that to be true. On the right-hand side, what you see is a multi-phase mixture, and on the very top, you see a clear liquid. And that clear liquid, if you take a drop of that and put it onto a surface, it will evaporate very, very quickly, much faster than water. And that indicates that that liquid is organic solvent. We conducted GCMS quantification and confirmation, and we also used proton NMR to characterize what those materials are. We found several compounds were emitted into air, and some, but not all of them, were present in the uncured resin tube. The reason why some of these were not present in the uncured resin tube is because cured-in-place pipe process is a chemical manufacturing process. So you start out with some chemicals that transform into others, and those other chemicals are the ones that are emitted. When you use a PID at different sites and you set it up at different locations, at that site, the emissions can be very high during the curing process and can decrease with time. What I want to bring your attention to on this figure is at about 37 minutes, you see a blue peak that goes over 500 ppm. That is before steam is injected, and we believe the reason why that could be is because forced air is injected before steam is injected for steam-cured CIPP. And this is basically taking chemicals from the uncured resin tube and then blowing them out to the exhaust pipe there. So there can be emissions before steam curing begins. As part of this study, we also captured that multi-phase mixture, and we exposed it to mouse lung cells. in those experiments indicated that toxicity occurred for some of the materials and not others, but that future health impact investigations are likely necessary because the material was not harmless and did indicate acute cytotoxicity. So one of our main conclusions here is people ask us, what do we believe? After conducting the study, what do we think? Well, CFPP technology has become widely used across the country without really a body of evidence that describes its short and long-term health or environmental impacts or how to prevent them. And there really isn't much scientific evidence to support positions otherwise. CFPP, we believe, could be used without endangering human health and the environment if appropriate safeguards are instituted. And our study focused on steam-cured CFPP sites, but we also looked at all available UV and hot water CFPP air monitoring data, and we also have other projects ongoing. So to kind of wrap this up, what can be done about this? Well, we think that there's different groups of individuals that can take different actions. In health professionals, I believe, and we believe here, health professionals should really take it upon themselves to start learning about this process, what is known, what is not known, because based on the incidents we reviewed, there are quite a few states, I believe 24 states, where air contamination incidents have been reported that we know of, and it's likely that these incidents may be happening in and around your community if this technology is being used. The state of California has developed a CFPP safety alert. They published this online in July 2017. And then last month, they published another posting associated with cured-in-place pipe additional considerations from municipalities based on the public health and occupational health perspective. Workers can request help from NIOSH. We've been urging many CFPP companies to contact NIOSH, and you're going to hear from NIOSH in a few minutes, because NIOSH truly has some amazing individuals that can provide assistance. NIOSH has worked extensively in the past with worker safety agencies. They've dealt with emissions issues in the composite industries, and workers can really rely on NIOSH for some solid support. Workers can learn more as well. They can go to CDC's website and read a blog post, and they can go to NEHA's website as well and learn about that. And the engineering community has a big role to play here, because engineers are ethically obligated to uphold the safety, health, and welfare of the public in the conduct of their duties, and make sure that they only issue truthful and objective statements. And so we have been telling engineering companies and engineers at municipalities and other places that our study indicates that the emissions are not harmless, and that there are higher levels than what has been detected in the past associated with styrene. People should require emission capture, confirmatory testing to prove that to be true, in addition to real-time monitoring. We also believe that notifying current and former employees, as well as stakeholders right now, should be notified that the short and long-term health impacts of these exposures are currently unknown. And I'd like to point out at the bottom of that slide there, some engineers have already begun to act by removing videos and statements and public notifications that made these statements that are unsubstantiated by evidence and proven false by the Purdue University study. So where we are today, we still need to repair drinking water and sewer pipes. CFPP use has caused harm and impacted the environment, but we believe that with appropriate safeguards, the technology can continue to be used to protect worker health and public health. Right now, workers and the public are not appropriately informed about what the emissions are and the consequences of the exposure, and we believe the health agencies, the local health departments, state health departments, county health departments have a very important role to play here in worker and public safety. We also recommend that emissions and public health exposure risks should be investigated. moving forward, we came up with about 20 studies that need to be done, but here's 8 that we think should be prioritized in some way. And we believe that the public health and occupational health communities should be engaged in this. I would just like to say there are 6 faculty that are co-authors on this presentation, but there are over 30 people that contributed to this research. They were students, they were staff, and there were various other professionals working at Purdue University. This research wouldn't have been possible without the support of the National Science Foundation, who funded the majority of the work, as well as the Purdue University, who provided funding for safety, and also the public, who provided donations for crowdfunding. And so with that, I'd like to conclude the presentation and pass it over to Dr. Whitehead.
Thank you, Andy. If you all could hold your questions until the end, I'd like to give Dr. Bailey and Dr. LaBeouf a chance to present before we get into questions. Rachel and Ryan?
All right, thank you. This is Dr. Rachel Bailey, and I will start off with giving a brief overview of the NIOSH Health Hazard Evaluation Program. So NIOSH, the National Institute for Occupational Safety and Health, is part of the Centers for Disease Control and Prevention, an agency in the Department of Health and Human Services. NIOSH is not a part of the Occupational Safety and Health Administration, or OSHA. NIOSH does not enforce workplace health and safety laws as OSHA does, but NIOSH does conduct scientific research to prevent work-related illness, injury, disability, and death, and translates and disseminates the knowledge gained into products, some of which are shown on the slide, and many more are found on the NIOSH website. We respond to requests for workplace health hazard evaluations and investigate possible workplace health hazards and make recommendations. Through the Health Hazard Evaluation Program, NIOSH determines whether workers are exposed to harmful substances, agents, or conditions. This is a free service in which we provide facility-specific recommendations and control hazards. NIOSH evaluates multiple types of hazards, ranging from chemical, biological, and physical hazards, such as heat, stress, noise, radiation, and ergonomic stressors. NIOSH also has experts that can assess work organization and job stress issues. The Health Hazard Evaluation Program is located in 2 divisions at NIOSH, the Respiratory Health Division, located in Morgantown, West Virginia, and the Division of Surveillance, Hazard Evaluations, and Field Studies, located in Cincinnati, Ohio. This is a multidisciplinary program. Our staff have various professional backgrounds ranging from physicians, nurses, epidemiologists, industrial hygienists, veterinarians, ventilation experts, chemists, medical and environmental technicians, and statisticians. Additionally, when needed, the Health Hazard Evaluation Program has access to other specialists from other divisions at NIOSH. The Health Hazard Evaluation Program is a federally mandated program. There is a specific legislation authorizing the Health Hazard Evaluation Program. NIOSH itself was created as a research and training agency by the Occupational Safety and Health Act in 1970, and the Health Hazard Evaluation Program was mandated by Congress with Section 20A6 of the OSH Act in 1970 and expanded under the Mine Safety and Health Act in 1977. The specifics of the program are spelled out in the Code of Federal Regulations, which describes, among other things, NIOSH's right of entry into workplaces when we have a valid health hazard evaluation request, NIOSH's right to access to pertinent records, such as environmental and medical records maintained by the employer or third parties, NIOSH's right to conduct private and confidential employee interviews, to request space for confidential interviews and exams, to require employee representation at meetings and walkthrough surveys, and additionally, NIOSH can act on conditions of imminent danger. Now, who can request a health hazard evaluation? An employer can request an evaluation, as well as a union representative. So that's an authorized representative of the employees for collective bargaining purposes. Employees also can request health hazard evaluations. For workplaces with more than 3 employees, 3 current employees must request the health hazard evaluation. In workplaces with 3 or fewer employees, 1 current employee may request a health hazard evaluation. And we also provide assistance to local, state, and federal agencies upon request. During health hazard evaluations, employee requesters can remain confidential, meaning we will not release their names to their employer or others. Employee participation in the evaluation itself is voluntary. For example, participation in all or parts of a medical survey or wearing personal air sampling devices is voluntary. Any personal information we collect is confidential. We conduct interviews and exams in private. Requesters and health evaluation participants are protected by the OSHA Whistleblower Protection from Discrimination and Retaliatory Acts. When can a health hazard evaluation help? Well, when there are new hazards, exposures, processes, or controls, when there are illnesses in the workplace from an unknown cause, and also to exposures to unrelated agents or hazards, or adverse health effects as exposures less than current standards. When NIOSH evaluates more common types of hazards, a site visit is not always needed. When a site visit is not done, the health hazard evaluation program usually discusses the concerns with the requester and other stakeholders and provides a written response that includes an assessment of the situation and guidance on reducing or eliminating the hazards. We often respond to health hazard evaluation requests dealing with indoor dampness and mold in this way. NIOSH published an alert, as pictured on the slide, about preventing occupational respiratory disease from exposures caused by dampness in office buildings, schools, and other non-industrial settings. The alert describes respiratory problems that occupants may experience from exposure in damp buildings, presents summary information on outbreaks of building-related respiratory disease, and provides recommendations on how to identify, respond to, and prevent building dampness and related respiratory symptoms and disease. And often, in addition to our written response of the assessment of the situation at a specific facility dealing with mold and dampness issues, we often include the alert and other documents as enclosures. Site visits are done in workplaces that have serious health effects that could be related to the workplace, and when there are new or emerging issues, site visits might include one or more of the following: observations of processes and procedures in the workplace, discussion with workers, supervisors, managers, and union representatives, review of various documents, including exposure records, safety data sheets, written respiratory protection and HAZCOM programs, OSHA logs and health records, evaluation of controls, confidential medical interviews and exams, collection of environmental and biological samples. Due to the complex nature of some health hazard evaluations, one or more site visits may be needed to complete an evaluation. When the information and data for an evaluation has been analyzed, NIOSH publishes a final report that gives our findings and recommendations. Copies of the report are sent to the requester, employer, employee representatives, OSHA, and other relevant agencies. The employer is required to post the final report for at least 30 days in a place that's accessible to the workers. Final reports are also posted on our NIOSH website for a wider audience so that others may benefit from the findings and recommendations. What is the impact of health hazard evaluations? Well, at specific work sites, we identify hazards, assess controls, document exposures and health effects, and provide site-specific recommendations. In our reports, we describe in detail our sampling and analytic and epidemiologic methods. And this slide shows a picture of a NIOSH best practices document. It is a guidance document NIOSH developed to reduce workers' exposures to alpha-diketones, diacetyl, and 2,3-pentane-dione through engineering controls, best work practices, and techniques for monitoring airborne exposures. The document resulted from work done in various NIOSH divisions, including the Health Hazard Evaluation Program, where we conducted a number of evaluations in work sites that used or made flavorings containing alpha-diketones. It's very easy to request. It's easy to request a health hazard evaluation. The request form and the instructions are available online on our website and can be submitted through the NIOSH website. We also accept requests by email and fax, and you can always give us a call and we can talk about the program. As mentioned earlier, our health hazard evaluation final reports are available on the NIOSH website. And now Dr. Ryan LaBeouf is going to briefly discuss a health hazard evaluation at a power generating wind blade manufacturing plant. Dr. LaBeouf?
So this is an example health hazard evaluation involving styrene and dust exposures at a wind turbine blade manufacturing facility where we conducted air monitoring for exposures and evaluated employee health. This is a management request since industrial hygiene surveys in 2007 and 2008 showed elevated styrene and dust exposures that were concerning. Since that time, the company sought to reduce exposures by product substitution and improvements to ventilation, changing employee practices, and the use of personal protective equipment. And at the time of the survey, had about 300 to 500 employees. So it's a fairly large site. A little background on the process. The blades that they produce are typically 42 meters long. The basic construction of the blades includes balsa wood, reinforced with fiberglass outer shell supported by interior braces. The outer blade shell is made of two halves, each molded separately and then sealed together with adhesive and fiberglass patches. First, the molds are sprayed with a styrene-containing pigmented resin, which hardens, becoming the outer layer of the blade. Then a textile fiberglass sheet and balsa wood are layered into the mold. The mold is covered with a thin plastic sheet, vacuumed to the shell, and injected with resin. And then there's a manual application of fiberglass resin patches, which are sanded and patched. And then the two halves of the mold are put together with a styrene-containing glue. The interior bracing is added to the other half, and they're put together, finished, and sanded. So you can see here a picture of several of these wind blade turbines. These are web molds during the resin infusion. You can see a picture of the thin plastic sheets, and they apply a vacuum for resin infusion. This next picture is a resin-impregnated fiberglass patch, and this material is used in the various plants. I think somebody needs to go on mute.
Oh my God, it scared me. No, I closed it. I closed it totally.
I can still hear somebody.
Oh my God, I don't have microphones.
If you could all go on mute, please.
Yeah, I don't think I do. You know what? Let me just leave the page.
So our this picture is a resin-impregnated fiberglass patch. It's done in the open area, but it is a product that contains 40% styrene. And here you can see the base or root of the blade with a safety platform installed. Prior to the installation of the safety platform, people are going in and out of this blade, and you'll see later in the results some of the higher concentrations that we measured were actually inside the blade, where chemicals can accumulate in that sealed space. And this last picture is a blade ready to be finished for coating and final assembly. So part of our methods, as Rachel discussed, in this particular plant, we walk through, we observe processes, trying to understand the process and the work practices. Sometimes we'll collect screening samples, we'll review records and coordinate subsequent sampling. When we returned, we sampled for dust, styrene, and xylene in air. So one of their substitutions was for a styrene-containing product was for a xylene-containing product. We also look at ventilation. Ventilation is key. We looked at both general building exhaust and specifically local exhaust ventilation because local exhaust ventilation is an important way to control emissions at the source and reduce potential employee exposures. We also conducted medical testing, which included a standardized health questionnaire. And since styrene is known to affect the central nervous system, we looked at neurological effects as well in the form of standard visual acuity, visual contrast, and color vision testing. We also performed breathing tests. Typically, these involve looking at lung function, where we're looking at how much people can inhale and exhale using a spirometer. In this case, we also looked at urine tests for styrene metabolites. So in addition to monitoring the air, we also looked at how it's accumulating in the body as a measure of styrene exposure. So into the results, styrene exposures did exceed occupational exposure limits while working inside the blade, and this is not necessarily surprising because you have that sealed space, a lot of styrene-containing products being used that are off-gassed. Airborne styrene concentrations were highest after the initial gel coating, and dust exposures exceeded occupational exposure limits also inside the blade during grinding, despite using powered hand tools with a dedicated local exhaust ventilation. We also saw from the medical tests an excess of color blindness. And when we compared styrene exposures to health effects, there were associations between these exposures and visual contrast deficits, respiratory symptoms, and we also saw reduced lung function. So in our conclusions, we use the use of respiratory protection in high exposure tasks did reduce the exposures to below occupational exposure limits. By combining medical and exposure monitoring, we were able to reveal acute effects on vision as well as long-term effects on respiratory health. Some jobs and tasks that we presume to be safe or the company presumed to be safe may require additional respiratory protection. For example, this one job, blade entry attendants, if they're going inside the blade, we saw these accumulated exposures inside the blade. This was all based on personal exposure monitoring. We also recommended that they consider eliminating grinding tasks that were only really for looks and didn't affect the performance of the blade as a way of reducing exposures. And then our typical hierarchy of controls for industrial hygienists, where we look at eliminating or substituting, which the company was already working on, substituting styrene-containing products or xylene-containing products. Specific engineering controls like local exhaust ventilation to control the emissions at the source, as well as administrative controls like modification of work practices and the use of personal protective equipment. The specific recommendations for this plant were to substitute styrene-containing gel coat, resin, and paint for less hazardous products, if possible. Use HEPA-filtered vacuums instead of compressed air, which blows around dust. Modify the work practices to eliminate as much cut and trim work as possible. Institute a medical monitoring program and use the results to inform additional controls, and reevaluate the personal protective program and require the use of newly identified jobs like bushing windings employees and blade cut and trim employees to wear personal protective equipment. And that's the end of our NIOSH part of the talk.
All right, thank you very much, Rachel and Ryan and Andy. We have a few questions that were typed into the chat box, and I'll read some of them. One person wants to know, this is for the NIOSH team, Has any worker requested a NIOSH study, any worker that works with CIPP?
No, not at this time. We have not received any requests for health hazard evaluations in that industry currently.
All right, thank you, Rachel. Andy, we had a question about the funders of the study, of the Purdue study. Could you clarify? I put this slide back up there so that folks could see, but one question was who paid for this webinar, and the other question was who funded your study. Would you like to talk a little bit about that?
Certainly. So the National Science Foundation provided Purdue University, I believe, about $49,000 to start the rapid response study. The grant number is shown on the screen there at CBET 1624183, and you can go to the National Science Foundation.gov website and read the abstract of that study. The public donations were funded through crowdfunding. That is where we went and set up a website and asked for members of the public to, regardless of their backgrounds or their expertise or where they live, to provide money so that we may be able to complete the study in partnership with Purdue University. And so there was a GoFundMe, I think, page set up, and then there was a Purdue University page set up as well, crowdfunding. The Purdue University Lyle School of Civil Engineering also provided us funding to buy safety equipment after we conducted initial testing and the data indicated that there may be worksite safety issues. Purdue University gave us funding to buy respiratory protection and other equipment that we didn't anticipate to need at the beginning of the study based on our review of the literature. In addition to that, Purdue University is supporting us today here at the university and supported us before through a position as being a faculty member at the university. Several of the students are also graduate students and undergraduate students, and there are, I think that's about it. Who supported the webinar? So the webinar, again, there's no money changing hands here. We didn't pay the National Environmental Health Association to host this webinar, and they didn't pay us to participate in this webinar. And I can't speak for NIOSH, but my assumption is that NIOSH is doing it out of the goodness of their heart and the mission of their organization, in the same way we are trying to advance the state of knowledge associated with CIPP.
Thank you, Andy. Another question, I think this goes to the Purdue team. What is your relationship with the industry trade organizations related to this research?
We have communicated with CIPP companies directly. CIPP workers, we're involved in the American Water Works Association, some of us are, in other associations associated with drinking water and stormwater and wastewater professionals. We just came back from a conference in Chicago that pertained to this. So our relationship is that we're aware of the associations. We've been contacted by utilities, CIPP companies. We've been visited by CIPP companies who have indicated they want to take the next step and better understand their technology. So I think it's a good relationship, and we look forward to working with everybody.
Thank you. I think this next question can go to either team. Regarding CIPP, since many municipalities are required to request bids and award bids based on lowest cost, would it be possible to develop best practices in requests for bid contract language? This has had some success in the structural lead paint removal. Thoughts or ideas on that?
So this is Andy Welton from Purdue University. We were just talking on mute about this. We think that public health and worker safety should be paramount above all, and then based on the necessary controls and modifications needed, then you would go in and determine what the cost could be, and then incorporate those evidence-based specifications into the construction and bid contracts. We're working right now with 6 different states on a study to develop evidence-based specifications for pipe repairs, and we think that's probably the way to go, because if you just change specifications without evidence, there's no guarantee that they will effectively protect the populations that you're trying to better protect.
It was mentioned that the CIPP can be continued with appropriate safeguards, but the requester would like to know what the appropriate safeguards are. Rachel or Ryan?
Could you repeat the question, please?
Sure. It was mentioned that CIPP can be continued with appropriate safeguards, but the person would like to know what the appropriate safeguards are.
I think that's a difficult question to answer without us investigating the process. So, like Rachel said, we haven't had any health hazard evaluation requests, and I'm not aware of any NIOSH researchers that are investigating cured-in-place piping at this time. So, really, to answer that, I think we'd have to get more involved and conduct sampling and be able to provide recommendations that way.
Okay. Let's see. Question for Andy. Sorry. Would the process of lining pipes cause an odor when a faucet in a home in this area is turned on, and also cause the water to taste bad?
I didn't hear the full question, but there have been incidents where improper handling of resin or installations has resulted in surface water contamination and subsequently drinking water contamination. And then people have smelled chemically contaminated water in their faucets because their drinking water was contaminated by something that wasn't drinking water related. There are a number of different technologies used to repair pipes, not just CIPP. There's spray-on liners, spray-on coatings, in other processes. So this study focused on sanitary sewer and storm sewer repair using CIPP, and drinking water was not a focus.
Are there studies underway to determine the contents of the off-gassing?
So this is John Howard at Purdue, and one of the things we focus on is the material characterization of what comes off of these pipes, both during manufacture and after manufacture. And so, yeah, we're definitely interested in understanding.
Mainstream Jim, how may I direct your call?
Yeah, I think there's some crosstalk there. But basically, yes, we are interested in understanding the off-gassing composition and also the kinetics of that over time. So some of what we've presented was really the manufacturing process, but we also want to understand holistically what's happening long term with these pipes, days out, weeks out, et cetera.
All right. So it looks like we have had some great chat in the chat box as well between our experts and our listeners. I'm going to open it up for anyone to type new questions in. Let's see, here's a new one. Would you say that the best way to ensure that CIPP workers and inspectors are properly protected would be to go through a NIOSH health hazard study?
So this is Andy Welton, and before NIOSH, talks, I think the I think it's important that the workers, whether they be employees, employers, or union representatives, take seriously and engage NIOSH because they are at no cost. They have the opportunity to come in, and they've helped other industries in the past. I think that is probably the fastest way to get an independent third party to help them understand the types of emissions. I think one of the complicating factors is, let's say if NIOSH were to go out to one sanitary sewer site, that doesn't necessarily mean that the next site would result in the same types of exposures. And so making certain that appropriate numbers of sites, the number of tests run, and types of materials would be important. We found solids, liquids, and gases being discharged from one sanitary sewer site. It's possible that may be at other sites or may not always be at all the sites. And so it's important, I think, that NIOSH get engaged, and the best way to do that is for the community to step up and take action. It's publicly available service for them, and I think transparency is very important.
Thank you. Another question for Andy. What made you undertake this study?
The cured-in-place pipe process is a very innovative process and has been used for many years in the U.S. and abroad. And Department of Transportation have been using it for quite some time. And years ago, they had contacted me about whether or not chemical emissions can cause fish kills and other types of environmental contamination events. And so over the several years, I've worked with several DOTs to try to better understand what types of materials are released during and after CFPP installation into water. Once we published the chemical release study from CFPP installations into water, people, including health departments, as well as members of the general public, started asking me about chemical emissions into the air. And so over time, I've worked with a number of people and then came to Purdue, where the expertise is here that understands composite manufacture, emissions, chemistry, kinetics. And so at Purdue, we have the team to then investigate these types of issues with industry and for industry, as well as the public health community.
All right, thank you. Here's a question for NIOSH. Did you find cases of worker-related asthma among the turbine blade workers?
We did have some, the investigators did find that there were overall 8 employees who took bronchodilator were classified as having reversible obstructive airways disease. There were 3 workers that had abnormally high FeNO that was above 50 parts per million. The investigators also found that the prevalence of symptoms varied by styrene exposure. So participants with current styrene exposure that was equal or greater than to the median had higher odds of chest tightness compared to participants with that was below the median, current styrene exposure that was below the median. Also, cumulative styrene exposure was associated with greater odds of wheeze and asthma-like symptoms. Additionally, I'll just mention too the prevalence of obstructive spirometry which is a breathing test, that was significantly higher, as well as the FEV1 FVC ratio, which is a variable that we calculate in spirometry, was lower in participants with cumulative styrene exposure that was greater or equal than to the median styrene exposure.
Thank you, Rachel. I'm going to go ahead and wrap up and thank our presenters. We really appreciate you all coming on and helping us understand CIPP and the implications and the resources that are available. This webinar has been recorded and will be posted in approximately a week on the NEHA.org website. Thank you to everyone for participating today.